Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Michelle Hedding is the Spiritual Care Coordinator at Washington Hospital. She received her master's degree in spirituality and culture from the Sophia Center at Holy Names University. She is a registered nurse with her master's in nursing. Michelle is also a certified hospice and palliative care nurse. She worked at Washington Hospital as a staff nurse prior to her current role as the Spiritual Care Coordinator. Diana Jaycox is a registered nurse. She is also a certified diabetes educator and has worked in diabetes education for over 3 decades. She spent 13 years of her career in the U.S. Army Nurse Corps, with service during the Vietnam era. During her time in the Army, Diana received her Bachelor's of Science and went on to earn her Master's in Nursing from San Francisco State University, with an emphasis on the clinical case management of patients with diabetes. Diana currently works with patients at Washington Hospital, providing education for those who have been admitted to the hospital and have a diagnosis of diabetes. She enjoys working with patients to set and achieve diabetes self-management goals.
I'm Michelle Hedding. I am a registered nurse, but I'm also the Spiritual Care Coordinator here at Washington. So I wear many different hats, and helping to support people through whatever process they're going through is a big part of my work. So I'm excited to be able to be here again and to be working with Diana to do this together. So we're going to talk a little bit about what our plan is for tonight. As Diana said, it's a little bit of a departure from what has been done before. It's not going to be straight lecture. The main reason that we're here is first to acknowledge the challenges that folks living with diabetes are facing, and then to talk about caring. Everyone that's here cares for the one that they're with or folks in their life. You know, caring is something that is easy to do, but sometimes you might need a little bit of help in knowing the best way to do that. So we're going to talk a little bit about that. And leading into that is that conversation about how best to care. The person with diabetes might say, I want help, I need help. But then the question is, how is it best to help? So we're going to talk some about that, give people tips, and those handouts are also helpful. We're going to discuss diabetes etiquette and talk through what that looks like. Then we're going to break into groups. I don't know how many people that are here are people that are living with diabetes, but our idea was that we're going to break into a group with folks that are living with diabetes themselves, and then have a group of caregivers and loved ones. So if you identify as both, you can decide which group you want to be in. And basically what that's going to do is create a little bit of safety so that in smaller groups we can talk about some of the topics that we're struggling with. Then we'll come back together and each of us will report back anonymously. Everyone can feel safe in sharing the different themes that came up in the groups. So that's kind of the game plan for tonight, just to give you guys a sense of where we're headed.
So we at Washington Hospital's diabetes program, we're really dedicated to helping the person with diabetes live a healthier, more productive life, a happy, healthy life. And I think for the most part, what we have focused on and do a lot of focusing on is this idea of the clinical side of diabetes. We, as providers, know and understand a lot about how diabetes works. And so there's a lot of stuff that is about food and medications and that kind of thing. But one of the things that has come up a lot as we're talking in our groups and we're doing our classes is that there is a side of diabetes that maybe we don't talk enough about, which also affects how well you live with this disease. And that is this emotional, spiritual side of diabetes, okay? As a person who lives with somebody near and dear to my heart who has diabetes and has a long history of family members with diabetes, I know that there are things that go on with my loved one's diabetes care that sometimes it's more than just being able to know what to eat and when to eat it. Oftentimes what gets in the way of taking good care of his diabetes has nothing to do with what he knows to be the right way to eat, for instance. There are a lot of different things going on in our lives that have absolutely nothing to do with diabetes, but indeed do affect how well he takes care of himself at any one time. And so I think it's important that we take a look at this topic and that we see what it is that we can do to be a better support person for a person with diabetes. And in terms of those of you who have diabetes, this is an opportunity for us to talk about some of those things that just drive you crazy about having diabetes that might or might not interfere with taking good care of yourself. So one of the things that we like to talk about when we're talking about how do we deal with providing support, okay? Oftentimes, I know one of the things that happens in our household a lot, I don't know if it happens for the rest of you, but a common topic in our household, it goes something like this, okay? My husband is having one of those really grumpy kind of days, and he's just kind of walking around after work and he's grumbling to himself, and the words that immediately come out of my mouth is, "Go check your blood sugar." And then he looks at me and he says, "It's not my blood sugar, it's the rest of you being a jerk." So knowing exactly how to let that loved one know that you want to help, and more importantly, in my husband's case, sometimes it's knowing when and how to ask for help. So we talk about appreciating your pals, okay? Sometimes I'm not the greatest pal, and maybe his best friend down the street is a better person for him to talk to, but we need to know just exactly how to ask for help, okay? Supporting habit changes. This is not an easy thing to do, and so being able to ask for help is a very important thing.
So another part of that appreciating your pals, in asking for support, you want to find a way to ask in a kind and considerate way. Like the story that you were just telling about your husband, he might have wanted to ask for help, but instead he kind of was grumpy. So sometimes by appreciating those that are in your life that want to help, asking them in a kind way can be helpful. And when they have helped you in some way, thanking them goes a long way. You know, whether it's something really small or something really big, letting them know that you really appreciate what they did for you can help to make things smoother going forward.
Again, one of the things about having pals or people who will support you is being able to seek out new friends. Again, sometimes we get kind of stuck in, you know, dealing with just the family members and maybe some close personal friends. They may not always be as supportive as we'd like them to be. And so sometimes going out and actually looking for new friends who actually understand about your diabetes, maybe somebody else in a support group or whatever who has diabetes, might be kind of helpful. And it might also kind of help to ease things a little bit in the home situation. So you're not always at each other and maybe not being as helpful as you'd like to be.
some of those people you might meet might be in a group like the group that we have here. You never know where you're going to find that next person that could be helpful in this process. So this concept of arresting the diabetes police, what you had said about the way you greeted your husband and told him to go check his blood sugar, that would be a good example of the diabetes police. Finding a way to redirect your energies and to be, again, positive, to try to find a way to truly support. And we're going to talk about lots of tips about that tonight. We know that the reason that you're doing whatever you're doing is because you want to help. So finding ways to redirect their caring. I mean, if they're telling you to check your blood sugar, it's because they're concerned about you, but you can help them to help you. Is I think the point of what we're trying to say, to help you guys to both be on the same team. Because you are, I mean, essentially you are on the same team, but everyone's kind of coming from their own point of view. So helping each other to help each other is the plan.
I think one of the things that I talk about with my own family, and especially with my husband, we have this conversation a lot, is that yes, there are some things that I do as the support person that probably aren't so helpful. And sometimes, he wants me to wear a big button that says you are not the blood sugar police. But there's also a part that the person with diabetes needs to kind of step up and kind of consider their own role, okay? A lot of what we do, okay, coming from a support person, right? I'm really, really concerned about my husband, right? I'm really, really concerned about my father and my aunts and the 3 or 4 uncles that have this diabetes and my brother. I worry a lot, okay? We want them to be with us, and we have a lot of fears. And so some of that you're hearing in terms of my nagging might just be my worry coming out. So maybe it would be best to kind of think about inviting me to kind of be a part and welcoming me into whatever is going on with you, so that I can at least be able to understand what is happening from your standpoint. So we talk about, share your blood sugars, share what's going on, what you think is interfering with you getting your blood sugars under control. Invite your family or friends to your next medical visit. And again, I can't say enough about being specific about what kind of help you really find to be helpful, and to essentially start talking. Okay? It's all about communicating at this point.
That was exactly where I was going next, is that it's all about the communication. That diabetes etiquette card, which there are copies on the back, we're going to go over that in detail in the second part, but really, truly, communication is going to be the answer. Coming from the place of knowing that there is caring, coming into communication is going to be the way to get through this together. So the next thing we're going to do is show a very short and very humorous video clip that will kind of pull some of these thoughts together. So I'm going to go ahead and do that.
Hi, I'm Jim Turner, and I should probably explain these. These are courtesy of the diabetes police.
Yeah, see? You're putting on too much weight. When you put on weight, your control always suffers. You know that. You should exercise more.
You really shouldn't be eating that.
Hmm?
You can cure diabetes by eating a diet of broccoli and cinnamon. You should be eating more of those.
Jim, I really don't see you testing enough.
Huh?
You should test more.
What?
People with diabetes can't eat cake.
Really?
Okay, that does it. You don't have the right to think for yourself. You do not have the right to manage your own diabetes.
Okay. We gotta talk about this. I really, really appreciate all that you've been doing to help me with my diabetes management. And your intentions are good, but it's really not helping. So I've kind of laid down the law, 4 laws to be exact. Number 1, we will be honest with each other. I won't cheat and you won't critique, okay? Number 2, if there's a problem, be part of the solution. Maybe make me a meal, a healthy meal, and have me over for dinner sometime. Number 3, learn more about the disease. Come to a doctor's appointment with me, or read a book, or go to a website. Go to dlife.com. And I'm gonna take a cold, hard look at what it is that I'm doing. And number 4, please never, ever use these words. You can't, you shouldn't, you better, or So, we're all agreed then? I'm going to make every attempt to deal with my diabetes in a more careful manner, and you're going to do your best to support me, not police me, okay? I think working together is the key. I think working together is the key.
It's true.
Correct. The key.
Oh! Oh, I have a message. Hold on.
So in seeing that, it kind of, in a humorous way, again, brings the points home that each side needs to take ownership of their part. The one who is living with diabetes needs to take ownership of their blood sugars and all the things that the loved one is concerned about. But it's important for everybody to do their part in their own way. As I was preparing for this, I gave thought to, since caring is the biggest part of why we're all here, to just sort of explain what is care? What does it mean to care? And in looking it up online, I'm just going to read through this. Effort made to do something correctly, safely, and without causing damage. That sounds like that kind of fits in with what we just talked about, right? To effectively take care of yourself and to care for the one that you're loving. Things that are done to keep someone healthy, safe, things that are done to keep something in good condition. So caring is not that hard to do, and yet it's the hardest thing to do. So we're going to talk about some tools to help to facilitate this caring.
So there is a group of people that have come together that have diabetes, and some providers that have come together and have created what is called the Diabetes Behavioral Institute. And one of the things that the Diabetes Behavioral Institute has done a lot of research and work on is the helping people with diabetes and helping people without diabetes who are support and care for people with diabetes to understand about how to change behaviors, how to motivate people to stay healthy, to do good things for themselves. And one of the best things that I think that has come out of the Behavioral Institute in a long time is these tips for people without diabetes to help people with diabetes. And they're calling it the diabetes etiquette tips. And so Michelle and I would like to take a few minutes to kind of explain some of those to you. Okay. So the first thing we wanted to look at, number 1, is don't offer unsolicited advice about my eating or other aspects of diabetes. Now, those of you out there who are the people with diabetes, I'm sure that you've experienced this. All of a sudden, everybody in the world knows how to take care of diabetes, and they know it so much better than you do, right? And they're all out there ready at the drop of a hat to give you advice on what you should do to cure your diabetes, okay? Whether it's sitting on the floor of somebody's barn because radioactive dirt has been found to cure diabetes, or the latest thing that's out there, if you take so many teaspoons of cinnamon a day, your blood sugars are going to be so much better. They mean well, okay? They're trying to help. but it isn't always helpful, especially when you're not ready at that point in time to actually have any advice. So one of the things that's really a good thing to kind of think about is if they didn't ask, you really shouldn't be telling them. Okay. The other thing is a do, right? Number 2, realize and appreciate that diabetes is hard work. I think one of the things that I always point out in my classes when I'm talking to people with diabetes is that we recognize that diabetes and caring for diabetes is not simple. Okay? There's a lot of things that we're asking you to do, most of which require some lifestyle changes. And when we're talking about lifestyle changes, we're talking about things that go to the very core of who you are, okay? For instance, food isn't always about fueling the body, right? So when I stand up there and tell somebody that, they really shouldn't eat 12 tortillas per meal, right? I'm thinking that that's like sitting down and eating an entire loaf of bread, and who does that, right? However, when my father finally pointed out to me one day, tortillas shouldn't be counted as part of the food group. This is actually his thought process, right? Tortillas are not a food, they are a utensil. And if you think about that, okay, if that's the way you're looking at a tortilla, when you are out of tortillas, you cannot finish the meal because you have nothing to eat it with. Now, when I changed my thinking and realized that that was the way he was looking at tortillas, it made a little bit more sense to me that maybe sitting there and telling him he could only have one per meal was never going to work. So I had to figure out some other way that we could keep the tortillas, but maybe get rid of or lessen some of the other carbohydrates so that we could work within his thought process. And once we did that, it made a lot more sense. Okay. So again, you need to kind of remember, this is not easy stuff. This goes, like I said, way down to the core of who you are.
So number 3 is don't tell me horror stories about your grandmother or other people with diabetes that you've heard. Fear is not going to motivate people. Focusing on the positive is probably a better approach. Like he was saying in the video, learning about diabetes, there are certain things that are kind of becoming myths, Yes, eating a whole cake, not a good idea. Eating a piece of cake, probably okay if you're balancing it out. Or the tortilla story. So having knowledge, getting support, and reassuring the person with diabetes is going to work a whole lot better than instilling fear in them from these horror stories that are probably old wives' tales anyways. So that's something else to consider. And then offer to join me in making healthy lifestyle changes. How many times have you tried to take on a new thing? Like for me, it was exercising. My wife and I were not exercising that much, and we found that if we got up early in the morning before the sun came out, taking a walk together was actually a really wonderful thing to do. So do join in and help. Same thing with healthy eating. I noticed that I was making choices for snacks during the day that maybe weren't the best choices. So I started cutting up fruits and vegetables, and I would make myself a little container. And then she looked at me and said, And so I offered, I said, do you want me to make you a container too? And now we're both in the habit of having fruits and vegetables instead of some other crunchy item. So things like that, just working together can actually make both of you improve your health. So.
Great. Don't look horrified when I'm checking my blood sugars or giving myself an injection. It certainly is not a fun thing to do. Nobody jumps up and down and says, I really am dying to get on insulin. I can hardly wait to give myself a shot. If that was the case, I probably wouldn't be spending as much time in my appointments trying to explain to people why we use insulin. I wouldn't have to spend as much time talking to people about why we check blood sugars. What does that do for you? How does that help? But it just amazes me sometimes the looks people give you When we're sitting, my husband and I are out somewhere, and he stops to check his blood sugar because he's not sure if he's high or low. The other thing that kind of goes along with that's also one of his absolute no-nos, is don't look at me when you see that high number and go, oh my! It's sometimes numbers are going to be high and sometimes they're going to be low, even though you've done everything you can possibly do to make those blood sugars be within the target range. There are just times in which our bodies do not read the same books that we do. But do ask me what might be helpful, okay? Again, there are probably a lot of little things that you could do. You talked about on the video, maybe you'd like to cook me that healthy meal. It's really difficult at times for us to think, okay, here we are again, it's time for dinner, and now I've got to fix something, and I've got to get all this stuff out, and I've got to put it together and make it all healthy, when it would be just as easy to run down to McDonald's and grab a quick hamburger. And so if you're helping me out, we have found, just like you were talking about, Michelle, when we have things cut up already and in the refrigerator ready to go, it makes a big difference when we're ready to finally fix a meal. So that was one of the things that we decided would be really helpful. We could actually help each other out by, instead of just throwing the vegetables and fruits into the refrigerator, into the produce bin, that we actually take the time to wash them, cut them up, and put them into containers that we could then grab them. It makes mealtime a lot more enjoyable. Cooking together is another thing that we discovered was something that we actually enjoyed doing. What I absolutely detested was that get home from work, make the meal, right? And then it's something that he doesn't want to eat anyway, right? Or he starts critiquing it. And I just want to throw my hands up in the air and say, okay, forget it. If you're not going to eat it, then you fix for yourself. But when we sat down and we talked about that behavior and we decided if we planned meals together, we cooked together, we share the task, that was something that would actually help him and help me to be a little healthier.
Teamwork.
Teamwork.
So here's a don't. Don't offer thoughtless reassurances. Like, hey, it could be worse. You could have cancer. That isn't really going to help anything. Diabetes is a hard thing to live with, and comparing it to different things isn't going to make anyone feel better. And a lot of times, I hope that isn't coming from your close loved ones, but a lot of times that's going to come from that well-meaning person in your life that knows you're living with diabetes and thinks that's going to somehow make you feel better. It won't. I'm pretty sure that's not going to make you feel better. Do be supportive of my efforts for self-care. Help to set up the environment, just like you were describing. I mean, it's like if you have the vegetables in the house and they're usable, then that's already a couple steps towards that healthy meal. Honor decisions during the holidays. That was when I was here last, was talking about the holidays. What I called this is don't be the cookie pusher. If someone with diabetes says, you know what, no thank you, respect that. Be okay with that. You know, it's not going to make anyone feel better if you're forcing something on someone. If they're making good decisions, honor that and actually congratulate them on that.
Good deal.
Yeah.
So don't peek or comment at my blood sugars without asking me first. Anybody have that? You know, my husband tells me his blood sugar meter is private. And I'm not supposed to be going. He says it's like going into his private diary and checking to see if he's been a good boy or not. He would much prefer that we ask how things are going. And if he wants to share with me what his blood sugars are doing, he will. If he wants to share with me how that last A1C was or whatever, he will. He doesn't really appreciate me going into the computer and looking up into his My Chart and figuring out what it is that's been happening in his life. So it is a private thing. And like I can't emphasize enough, I hear it all the time from our patients. I do everything I'm supposed to do, and my numbers still turn out to be too high at times or too low. They're not lying to you. Diabetes is not an easy thing. And if our bodies did exactly what they were supposed to do with sugar and with the food that we were eating, that would be wonderful. But something is broken inside, and we don't always understand it. It's not rocket science, unfortunately. I can't input food number whatever and have it come out with a perfect blood sugar. Believe it or not, those of us without diabetes, we have highs and lows in our blood sugars too. It's just that they're not to the extremes that we sometimes see in diabetes. So we just need to remember to be a little bit respectful of, others with diabetes and their private numbers. So.
Well, and like we talked about, if there's communication and open dialogue, it isn't going to be this secret thing. I mean, he's probably going to be willing to share if you're not looking over his shoulder, right? I mean, like, as you continue that communication, it makes it easier to get the information.
It's that idea of also that I'm good if my blood sugars are good, I'm bad if my blood sugars are bad. Numbers don't have emotions, feelings. They can't be good or bad. There's no moral to numbers. They are just numbers. But so often we treat people with diabetes in exactly that way. So they get to a point where they don't want to share with us because they're so used to the lecture or that feeling that I've done something wrong.
Yeah.
Okay. Do offer love and encouragement. And it's like I said, we can't emphasize enough how hard it sometimes is to manage diabetes. But if you're doing all these things and you've made the lifestyle changes and you're really making an effort to get your blood sugars under control, somebody should congratulate you on that, okay? Like I said, there is just so much that goes on in our lives that has nothing to do with diabetes and that we have to be thinking about. And so when we're able, with all that's going on in your life, to manage your diabetes and do it well, even if it's only 50% of the time, that's a big deal. And we should be congratulating you for that. And I think it just goes along with, again, what we were saying, Michelle, about the fact that for the most part, those of us who don't have diabetes, if we're trying to be in there, it's because we care, because we're concerned, that we're constantly trying to be a part of that other person's life, but maybe not always doing it in the most helpful way. So
to that end, we're going to break up now. Diana is going to take folks that are people with diabetes, and then I'm going to take the rest of the folks that are here as caregivers and support folks.
Okay, so
it was skewed a little bit. There weren't as many people on the caregiver side, but how was that? Did people enjoy having that opportunity?
Some head nodding going on.
Okay. So I didn't have a whole lot to report out on. Do you want to report out on some of the themes that came up in your group?
Okay. So, one of the things that comes up quite a bit is this idea that somehow, some way, diabetes was something that you brought on yourself. Okay. There are a lot of people who believe that you ate your way into diabetes and it's all your fault, and how frustrating that can be to somebody who's really trying to take care of themselves when everybody is looking at you and blaming you for your disease process. So one of the things that we like to point out to people who don't have diabetes is that diabetes in and of itself, no matter what type of diabetes it is not a personality disorder, right? Diabetes is caused by genetics, and most people with diabetes have fallen into a bad gene pool. It's not something that they could have gotten rid of. You're born with that gene. And certainly, especially in type 2 diabetes, as we get older, as we gain weight, as we become more sedentary, that can cause blood sugars to be worsened or further out of control. But the whole thing that starts this diabetes is genetics. Okay. Another one that we talked about is the horror story kind of thing. Everybody coming out of the woodworks who has a story about so-and-so who, you know, had something horrible that happened to them because of diabetes, you know. And if you only seen what I have seen in terms of foot ulcers and, you know, Uncle Billy Bob who lost, you know, his eyesight and was on dialysis and had both legs cut off by the time he died. Somehow people think that by telling you that, it's going to help you out. We talked about, you know, when somebody finds out that a woman is pregnant, they do the same thing, right? They come out of the woodwork telling you all about their 500 hours of labor and, you know, horrible stories that for a new time mom is probably not the best. But it seems to be human nature to do that kind of thing. But I want to assure people, one of the things we talk about in our diabetes program, and I shared this with our group, is that, and we say this over and over again, if you remember nothing else that I've ever said to you, remember that diabetes is the leading cause of absolutely nothing, right? And I can't emphasize that enough. The complications that we see that are related to diabetes are not caused by you having diabetes. Those complications are caused by uncontrolled high blood sugars over a period of time. And consequently, when we manage blood sugars, we actually manage complications. And there's a lot of research out there that actually has shown that we can reverse those complications in the case of mild complications, or we can actually stop the progression of. So any little thing that you do to take care of your blood sugars, even if it's something that doesn't seem like a big deal, you know, somebody who has decided to give up regular soda and drink more water, for instance, even though that might not make a dramatic change in blood sugars, it's a step in the right direction, and that might be a step towards preventing the complications of diabetes. Okay? And then a final thing we talked about is those people who, families and cultures in which eating is part of entertainment.
It's a social thing.
It's a social event. So no matter where you go or what you're doing, people are constantly plying you with food. And how hard that can be for somebody who has diabetes who's trying to take care of themselves when somebody is telling you, you know, Aunt Susie has been cooking for days and you'll hurt her feelings if you don't eat this. Or, you know, somebody who's saying, I found this brand new cookie recipe and I really need you to taste this for me. How that can't be really, really helpful. So I kind of encourage people, especially when I talk about food and diabetes, to remember that what we're teaching you about meal planning, about the timing and portion control, is not something we do just because you have diabetes. This is something that we actually teach children in school now. We're actually starting in the Head Start programs to talk about eating more fruits and vegetables, eating homemade foods instead of packaged and boxed foods. And if we all learn to eat healthier, we would probably have a lot less of any kind of disease process out there, whether it's hypertension, if it's obesity, if it's diabetes, cardiovascular disease, any of those could be helped by eating healthier. And so this shouldn't be something that we do just because you have diabetes, but something your whole family should embrace.
And that was actually one of the things that came up in my group, was that idea of it being supportive to both people to join in healthy eating habits. So that is a theme for sure. Well,
All right.
thank you guys for being here. Together, we can work together to be successful in helping each other through this. So thank you.